The DocTalk Show.
Dr. Billy talked about 80%, 85% of the pregnancies will go through normally and smoothly. But we have that 15% that we are majorly trying to help in the antenatal care clinic.
Basically, emphasizing and putting a lot more effort. And you find that we've talked about the 4 routine visits, but you find that in this class of people that we would regard as high-risk pregnancies, they might need to visit the hospital a little more often than
Of course, don't forget that every pregnancy is at risk.
Yes.
But this is a high risk.
Yeah.
Meaning every pregnancy is susceptible to bleeding, which can lead to problem. And susceptible to high blood pressure.
You can lose the pregnancy as a miscarriage. We have those who are more vulnerable than other pregnant mothers to get complications. For example, we have women who are more than 35 years. Woman who gets her first pregnancy after the age of 30.
That is a very big issue we have to be very careful. I mean, someone comes to you and you tell her, your pregnancy is high risk because you're 35.
You're 35.
Women, our wives, our mothers, our sisters, we have to be very careful. They are usually offended.
Unfortunately, I know, and of course...
You don't want us to study, you don't want us to go to school and finish PhD and then get pregnant.
Even our midwives label them
elderly prime gravids.
Elderly first-time mothers.
I would be very offended if at 35 I'm called
when
elder.
they were training, that is, they were just re-emphasizing the high risk by putting that word elder. A woman is very fertile from 18 years to maybe by 35. And after 35 years, some of your fertility is going down.
The hormones.
So meaning if you get problems, start getting problems at 35, you might struggle even to get another pregnancy.
We are also thinking that as anyone, even not the pregnant mothers, if anyone grows older, they are susceptible to these other complications of life.
High blood pressure, diabetes.
So if you add another risk factor of pregnancy, blood clots.
Like you said, that the pregnancy itself lowers your immunity. And the older you grow, the immunity is already low. So generally, let's try
even bone changes, they don't only occur in other forms of bones, but also in the pelvic bones. So their ability to push these babies. Yes.
Because of several factors in our country now, we are having high numbers of cesarean sections. So would you consider me, a woman with a previous cesarean section scar, as a high risk?
Yes, and that increases with the order of scars of previous cesarean.
More than 2 and above becomes even more risky.
The World Health Organization recommends, especially in our law settings, that we can try, someone who has had one cesarean section, we can try them on labor. If the reason for their previous operation is non-recurrent.
If my reason for getting the previous cesarean section is not like me having a small pelvis, I can be able to push my
If it's not something that I'm sure will happen the second time, then you can try them and usually and almost, rather always, this person has to deliver in a hospital.
Oh yes, they have to, because a scar could rupture.
It's a rupture, yes.
So you must be under the monitoring, close monitoring of a doctor.
Even in those low research settings where we have majority of our people, we encourage that midwives should refer these mothers to doctors at least at about 28 weeks. That is 7 months. Then they should hand over this mother to a doctor to make a birth plan, to make a proper assessment, and give them the right advice on how to deliver.
The way my old professor used to tell me that there's no doctor who has been taken to court for doing a cesarean section. But there are doctors in the courts of law for failure to do a cesarean section.
Yes, at the right time.
And of course, there are these mothers who have had problems before, like diabetes.
Oh yes, these comorbidities. You have high blood pressure, you have sickle cell, you have all these diseases that you had before the pregnancy. All those are also categorized into high-risk mothers. A mother who is diabetic, a woman who has high blood pressure, sickle cell disease.
Because each of those categories you're talking about, you're looking at a diabetic mother, so chances are high that, because what we usually fear about, one, the complication of diabetes is themselves on the mother, and then the baby. You're likely to have a big baby. This baby might be difficult to push.
The most chances to get a cesarean section.
Yes, and you might find that this is a mother who might even have to deliver a little earlier before term because you don't want the baby to become very big.
So that's why
high blood pressure itself, even when you have essential high blood pressure, rather you had your blood pressure before you conceived, your risks, your chances of having pressure associated with pregnancy are higher. So you need to be, of course, and then the complications of high blood pressure on the baby, like a slow growth rate of the baby, like premature delivery, like
and of course, even
death.
high blood pressure has been listed among the causes of maternal mortality.
Of women dying with pregnancies. That's why for any woman who has high blood pressure, she's a special case. She needs to come very early to the antenatal care clinic as soon as she realizes she's pregnant.
Preferably should be reviewed by a specialist.
Oh yes, the C-class, we need to really...
Yes.
And you know, it's very common. C-class are very common among the central Uganda, and that's where the Baganda and Wasoga, unlike other places, the north and.
In modern medicine, somehow you could determine whether your baby you're carrying is a C-class or not, but then that goes into
that will lead us into
complications whether you want to terminate the pregnancy or not.
And you know about abortions, safe abortions in pregnancy.
Medical reasons, you can determine whether your baby you're carrying in your womb as early as 3 months actually has sickle cell or not. Then we leave to you the decision.
And that brings me to the discussion of, we have antenatal classes. What do we give these women? We have birth plans. You'd have many people not making birth plans. You reach that end, you have to give birth and you have no birth plan.
Most of the information that people would need to know within the antenatal classes is discussed between the patient and their doctor. But we encourage that maybe small groups are made, because when you come to my consultation room, I'm seeing you as a person. But we encourage small groups to have classes.
Groups of pregnant mothers.
Sharing experiences. Because there are things that we call minor disorders of pregnancy that most people will have: a little bit of backache, a little bit of heaviness,
feeling like the pelvis is opening up.
Early pregnancy, I'm vomiting, I have nausea, I cannot eat. Then somewhere along the way, you want to eat everything.
So a support group of pregnant mothers.
Once you share these experiences, you know you're not alone. So within those groups, we support mothers, what we call the antenatal classes. Can be done by a midwife alone, can be done by a midwife and a doctor.
And we tell them about nutrition, what you should eat during pregnancy to increase your blood levels, to give balanced diet.
Doctor, what will I eat, what won't I eat?
Especially in this, right now every one of us is trying to lose weight. So you still find a pregnant woman trying to diet.
I was 46 kilograms, doctor, wow, I'm 55.
Yeah, and she wants to stay at 55 for 6 months, but at 9 months she still wants to be.
Want to cut the weight.
Well, most of them also ask if they should go to the gym, if they should go for yoga.
Exercises are absolutely okay. We just don't want you to do extraneous exercise in the first couple.
But the sauna is no go, I guess.
Yeah, areas that have very high temperatures,
very low temperatures.
Excessive temperatures are not good for our young.
What about us? For us now, for you, Dr. Jeff, for us, we go to the Catholic churches. At least drinking a beer or two is not a problem. So a mother always put to task, even one doctor, is it going to be a problem?
It's a glass of wine.
It also brings us back to our faith. Even our faith would comfortably say drinking is not bad, but it was difficult to avoid drinking excessively. That's why it was concluded that you shouldn't drink. Because you cannot, it's not easy for you to control yourself and say, okay, let me take one. One will lead to a second and second will lead to ultimately. But alcohol itself, we discourage people, especially pregnant mothers, from taking.
9 months.
Yes, 9 months. Wine has a lower risk than this other.
Beer and whiskey.
Yeah, so
just need alcohol? No.
I don't know if I should take wine.
Alcohol right now is not our biggest problem, especially in Kampala. Shisha is our problem.
And even smoking. Cigarettes,
smoking, marijuana.
All those are no-go areas.
Nicotine-containing drugs are not safe for our babies. And needless to say, we often have lots of other infections that we get during pregnancies. And we have a tendency of medicating ourselves. There are lots of medicines that are not safe.
Advisable in pregnancy.
Yes, are not safe with our babies. So before you choose on taking any medicine,
You have to visit your,
exactly,
visit your doctor.
Yes, there's this trend now, my doctor, my doctor. Okay, send him a WhatsApp, give him a call.
But generally, I want to believe that our mothers and our girls out there have now all understood what antenatal care is all about. It is to make your pregnancy experience memorable and fulfilling, so that by the end of your pregnancy, you can look forward to a healthy baby, a healthy mother, and a healthy father, because that is what I see these days in essence.
And
having
a successful antenatal delivery will end into a successful delivery. Antenatal care will end into a successful delivery, a healthy baby, a healthy mother, and 6 weeks after
And a healthy
delivery.
father.
And a healthy father.
Otherwise,
Yes.
mother,
I've seen posts on Facebook, mother, baby, and father all stable,
stable.
And
which
dog
is
at home.
hilarious.